Welcome to Mom in Mind. I'm your host, Dr. Kat. As you all know who've been listening to the podcast for a while, it is very important to understand culture and how it impacts us in our own individual experience. And also, for those of us who might not be within the culture of the person we're speaking with, to remember that cultural context, cultural experience really has a huge impact on how we as the individual within that culture experience the world as well as our own mental health. And we must always understand that people are experiencing their mental health within their own context as well. My guest today, Kalena Kaopuuokalani Lanuza, is coming on to share her experience as a Kanaka Maoli, which means Native Hawaiian. She is a doctorally prepared, dual certified family and psychiatric mental health nurse practitioner and certified lactation counselor. She currently resides in the unceded territory of the Ventureño Chumash, which is commonly known as Ventura, California. Some of the things that she discusses in our conversation together is the connection between colonialism and settler colonialism, cultural and generational trauma, and mood and anxiety disorders in Native Hawaiians and Pasifika. Other things she shares with us are some of her personal story, but also her work now and how the use of reconnecting to culture and land can be an important element in assisting Native Hawaiian and Pasifika who were removed from their ancestral land. How helpful that can be in the healing process through the perinatal period and beyond. I thank you for being here for this really important conversation. Let's meet Kalena. Welcome, Kalena. Thank you so much for being with us.
Oh, mahalo nui, Kat. It's an honor to be able to share space with you today and to just to be able to talk about Native Hawaiian and Pacific Islander perinatal mental health. It's a true passion of mine, and I really mahalo you or thank you for creating this space for all of us across the country. I know there are many listeners, and I'm really excited to be here with you today.
I'm really excited to learn more about the intersection between perinatal mental health and the culture of Native Hawaiians and Pacifica. Is that correct?
Pasifika, yes.
Pacifica. Um, yeah, there's so much to get into, and I know that this is a really important area for all of us to be understanding more and learning about, and not only for those of us who are learning about the culture, but also, as you know, there are just so many ways that culture is for many reasons has had to blend in the past, and being able to talk about all of this with you is hopefully a way to not have that be the case anymore, to have to blend in and pretend things don't exist when they do exist. um,
Right.
yes. So anyhow, I'm really interested to know more about you and how you became interested in perinatal mental health.
Okay. So as you said in my bio, I am a family nurse practitioner and a psychiatric mental health nurse practitioner, and I've been a nurse for almost 30 years now. It's been a while. And a lot of my career has been focused on the women and children aspect of caring. And in 20 let's see, in 2017, I started working in women's health, and
Mhm.
I started to see in the OBGYN setting that I was in a lot of perinatal mood and anxiety disorders. And I
Mhm.
didn't really know, what could be done about this. I experienced perinatal anxiety when I had my son in 2014. And so I knew that, this is something similar that I felt. This is what I'm seeing in my clinical practice.
Mhm.
So I really started to dive in a little deeper to the whole perinatal, world, and I decided to go back to school and get a doctorate degree and do my big project on screening in the OB setting.
Mm.
And with that project and getting more involved in this sort of area of practice, I really realized that. you know, there's something that I can do as a Kanaka Maoli, as a Pacific Islander, to possibly help the people that are living here. I do live in Southern California. I'm away from Hawaii. To help the people that are living here throughout the diaspora if they experience these types of things.
Mhm.
So there was a lot of sort of evolvement of my realization that perinatal mood and anxiety disorders actually existed, because when
Mhm.
I had perinatal anxiety, my OB literally just said, you know, we all go through it. You just have to go back to work. At the time, I was
Mm.
working as an NICU nurse, and it was really challenging for
Oh,
me to be able to go
whoa.
back to work, having a premature child
Mm.
myself. And I just realized, you know, fast forward when I was in this position and seeing this in a Southern California suburban setting, and women were really having a tough go of finding resources and getting the true care that they needed, that if there was a way that I could be available to my people who were going through this, because if I was going through it, others were, that I would do that. And
Mhm.
so after I got my doctorate degree, worked in OB a little bit longer, really got involved in a lot more of the perinatal mental health world. Then I went back and did a post-cert in psychiatric mental health during the pandemic. I was
Mm.
teaching at a university, teaching in a doctoral program, and there were a lot of things, you know, that came up for many of us during that time. And one of the things, as a mother of a young child who I was having to homeschool, was that I didn't have capacity to do all the things. And I
Mhm.
thought, what do I want to do with my time? So I went
Mhm.
back, got the certificate, and then last June opened my practice. And I opened my practice with the idea that I was going to intentionally be available for other Native Hawaiians or Kanaka Maoli and Pasifika throughout the diaspora. And one of the reasons that I chose to do that was, if we can go back a little bit in
Mhm.
time when I was figuring all of this out, was that when I struggled with this in 2014, one of the things that a friend said was, Kalena, I think you should go see a therapist. And I thought, okay, I'll do that. Let me figure that out. Who do I want to go see? And
Mhm.
so intuitively, I just started to seek out people that I knew in my na'au or my gut would be healing for me. So I was flipping through all the online stuff that they had at the time. It wasn't as good as now, but I didn't see anybody that looked like me. There was nobody. I
Mhm.
saw a few Latina therapists, but there really weren't folks. And so then I thought, okay, well, that's okay. I can just look back home. I'll just go and look at the Psychology Today stuff or whatever back in
Mhm.
Hawaii. And then I learned that I couldn't see somebody there because I lived here. And there
Mhm.
were these laws, right?
Mhm. Mhm.
The barriers. Another barrier. This you can't go into another state unless somebody's licensed in another state. And so in this time period where I really needed extra help, like to connect to all the things that would have nurtured me as a Kanaka Maoli and a new makuhina or a new mom, I couldn't find that. And so I had to do something else. And I found a white therapist here, and they helped me move through what I needed to move through. And they were very helpful. But now I know that, geez, there were things that I really probably could have used
Mhm.
from another Native Hawaiian person.
Mhm.
And so again, when I found myself still living here and being in this space, I thought, okay, I'm going to create my practice. And my practice is going to be called Mana Mental Health. And mana is to Hawaiian people and many people across Pasifika, it's this sort of internal energy that we believe we have and that all things have. Even pohaku or a rock has mana. Of course, you know, lava has mana, the wind has mana. Every living person, everything that I think most Western people wouldn't consider living, like a rock, has mana to us. And I really wanted to just put it all out there in the name and everything, that I was going to be here to help figure out why your mana was so off, and to figure out ways in which we could together tap into these resources that I know, you know, this ancestral wisdom that I know and I'm so fortunate to be able to still have, to help us, you know, help each other, this other person on the other side of my screen, rebalance their mana. So that's kind of how I found my way in this world of perinatal mental health, and more specifically, how I chose to be available to other Native Hawaiians and Pacific Islanders in the diaspora.
Oh, fantastic. Right. Isn't that amazing just how clear things can become once you've been touched in certain
Yes.
ways? I mean, it sounds so um I don't know of a better word other than kind of like a calling or a direction or a
Mm,
something. Maybe there's a better word for it, but I mean, just hearing you and then seeing you talk about it, I can see um, just how deeply rooted it is in terms of importance um, for
yes.
you, but for what you want to do in the world.
Yes, I think again, being a nurse for many, many years and sort of growing up in this very Western system, there's a lot of push and pull that goes on there. But when I sat through the pandemic, and when I sat through and lived through and was present in the many things that are going on in Hawaii, with respect to sovereignty, indigenous rights, our land, our vai, our water. And again, if I've been a nurse for 30 years, then I've been in this realm for like almost half a century, right? I've been here for a while, and I thought, what do I want to do with the rest of my time
Mm,
here? And what do I want to do for my young Keiki, my child? What do I want him to see? And this felt like the truest space for me to be in right now, to
mhm.
use all the degrees and the training and all the stuff, and to use it in a way that I felt was pono or right and just, to use it in a way that I could help other mothers and families who are experiencing really, really challenging times during this time period of bringing new life into this world. And so, yeah, it was, if you will, a calling. And I'm so, so happy that I was able to hear that calling,
Mhm.
because so much of my career has been, as we talked before we really got into this, um, so much of my career has been me as a Kanaka Maoli in very Western spaces, right? Sitting at very Western tables, being in faculty meetings as the only Indigenous person, being the only Indigenous provider. And so with that comes sort of, again, what you were talking about, this acculturation or assimilation, if you will, into sort of this Western paradigm.
Mhm.
And so I'm so, again, happy that I was able to hear whatever it was, my ancestors, my kupuna, the akua, the amakua, all these other things that came to be, that really helped tell me, like, no, Kalena, now's the time. You be available for this. And it's been such a beautiful thing to be able to be available for this work.
Yeah. Um, if you can expand a little bit on, I guess, sitting on this side of like, coming out of the kind of Western medical stuff, let's just call it that,
Mhm.
and sitting on this side of seeing now after some of your healing that you could have really used a native voice for support. What do you, what for you, I guess, do you think now is what not could have been useful for you specifically, but just in general, like for people who are dealing with a perinatal mental health condition who are not getting the kind of culturally connected support that they need?
Yeah. I think one of the beautiful things, if you will, about COVID and that time period is our ability to connect through social media and through Zoom and all of these
Mhm.
other things. These weren't really available or as readily available before.
Right.
And so, even though laws still exist that prevent practitioners in Hawaii or other parts of Pasifika from seeing folks throughout the diaspora legally, if you will, who are
Mhm.
therapists or psychiatrists, we can still connect to many, many different things that help ground us as Indigenous peoples, as island peoples. We can still connect with our homelands. We can still now take courses online that teach us about our language and our traditional birthing practices, that teach us about our traditional plants. So there are a lot more opportunities to be able to connect in that way. um, albeit I think that there still needs to be more work on the legislative front, if you will, to decrease barriers with respect to receiving culturally congruent care.
Mhm.
And I think I appreciate the reasons for the laws and not being able to see somebody in another state. I understand all of those, but I also think that if we're truly going to reach a space of true cultural competence for all of us, we really need to look at then, okay, folks who are Indigenous, who are Native, how can they reach this care? It takes so much more than a PowerPoint to
Mhm.
learn not only about our culture, and I don't even think you can ever learn about our cultures unless you're like in it, right?
Mhm.
Because again, there's that ancestral line, yeah. But it takes so much more than that, and really, as you probably know, that's really all that's offered. Are a PowerPoint with a check off and a certificate, and you're ready to
Mhm.
go,
Mhm.
and you're considered to be good. And with that, comes possibly a lot of harm, And so I think really ensuring that we can continue to connect via these electronic means to our sources, to our own people is important. And then also really on the other end too, while we're here and if we're gonna be here, really trying to make some headway in these legislative processes to relook at what culturally congruent care looks like, especially for diasporic folks, is something we need to do.
Right. And mm, I don't know if this question's going to make sense, but I wonder if like kind of the farther, so to speak, people are away from like their native land, how much more disconnected people become, and like
Mm.
not really, how can I say, like it would be hard to know what the generational stuff is, both for difficult and the things that are keep you deeply connected. Difficult meaning like how and why you're not in your native land, or why you had to leave, those kinds of
Mhm.
things. Um, it, it would be hard to understand if you're several thousand miles away from where you feel most connected, to understand why you are feeling all the things you're feeling. And then if you're in and amongst people who also don't have the same connection to culture. I mean, I'm speaking broadly about culture now.
Yeah.
But how much harder it would feel to feel, um, what's the word I want to use? Not held, but to understand why you feel the way you feel.
Yeah, and I think, I mean, you bring up a great point, and especially with Native Hawaiians, our people, and when you look at our creation stories, we are inextricably tied to Aina. Aina is land. And so now, when you have, for instance, I'm second generation diaspora, right? My father came here from Hawaii. I was born here in these waters of the Chumash people. This is where I was raised for a good portion of my life until I was able to go back to Hawaii and live. But when you and I see this a lot in my practice, when you work with folks that are part of the diaspora, it really does depend on how far removed, if you will, they are from
Mhm.
our homeland. And so again, me, I only knew this growing up. This was
Mhm.
all I knew. And whatever my father was able to give me and the other Kanaka Maoli around or other Pasifika around, but it wasn't until I actually moved back home and really got to put my feet in that sand and swim in that ocean that I was able to kind of have everything click. Now, that being said, there are folks that I take care of. I'm licensed here in California and in Oregon. So there's folks that I take care of again that are second, third generation diaspora Kanaka or Pasifika. And what does that look like, And that, in my clinical practice anyway, looks a lot like, okay, let's reground us together.
Mhm.
Let's look at what you do know. So this cultural assessment, if you will, I think it's Eduardo Duran. I don't know if you know him, but he is a Native
Mhm.
American psychologist. He does a lot of work surrounding therapy in Indian country, and in I think it's healing the soul wound that he writes. One of his first things that he does in therapy is really looking at to what level is the person that you're sitting with acculturated? Like, to what level of acculturation has occurred, and how has it occurred? Have they assimilated? Have they sort of, like, said, no, I'm not doing this, I'm very grounded in my, in this culture? So it just depends on who I'm sitting with as to what we do. But often, after finding out, then really in my practice, there's always then a rather quick reconnection to some degree to Aina and to our source and to traditional practices, even if we have to do that on someone else's land. And so I try to reconnect some of my clients to the indigenous tribes where they live, just so that they can be connected to, the land that they're on in some way. It takes a variety of forms, but it really does depend on, again, what you said, how far removed they are and how much time has been spent away from those things that, again, are going to ground us. So a large part of my practice, even though I'm a psych NP, yes, I prescribe all the stuff, right? Or I can, but a large part of my practice when working with Kanaka Maoli and Pasifika is to really reconnect us to that, that sort of like big source of mana for us.
Mhm.
And so aside from being physically sort of dislocated or located away from your land, there's also, the really real ramifications of colonization and settler colonialism, and how that sort of influences the way in which we heal or experience, mental health challenges. For instance, Hawaii has been occupied by the United States now for the last 130 years, well, longer, but illegally occupied. And so with that comes this whole challenge of like, okay, you're in the beginning, my kupuna, my ancestors were literally beaten for speaking Hawaiian. We had laws that prevented us from speaking Hawaiian language, from having any of our own cultural practices anymore, dancing hula, any of our olis or prayers or songs. Christianity came in full force. So, all of our gods that we had, those were sort of taken away. Just this huge disconnection right away, when all of this happened back in 1893. And throughout the years, as the ones that were left of us, which is only about 20%, had children, those children then were taught only what they could be taught. And so, for instance, my father never spoke, he never spoke Hawaiian. His mother didn't speak Hawaiian because her mother was beaten for speaking Hawaiian. So, intergenerationally and epigenetically, you have transfer, right, of all of this trauma. And so I think the state that some of my clients find themselves in, especially living away from the Aina, which is such a core element of being Native Hawaiian, is that not only are they away from this really healing source, we have, several generations of this trauma that is instilled in our DNA. And so when we birth, when we create life, and when we do these big, big things, historically, we had systems for this, like many indigenous cultures did. We had a lot of support. And not only do we not have those because we're outside of our space, right? But even if we are living in Hawaii, I think only 20% of the population is Native Hawaiian. We still are really, having these very detrimental effects of intergenerational trauma come through. And continued colonialism. So that's like what settler colonialism, right? Still trying to have to figure out how to assimilate, still trying to figure out how to live in this space, and get back to your source, but you can't because of a variety of reasons. It's really challenging, Kat. And I think for me as a provider here in this space, in the United States, it's something that has to really be part of my therapeutic process. I have to constantly remember the historical context, um, that comes with whoever it is that I'm working with. For instance, Chamorro folks, right? Like people from Guam, that's a different relationship with the United States. That's a different relationship with colonialism. Marshallese folks, right? That's a different relationship too. Samoa, different. There's Pacific Islanders are we're a large swath from Micronesia, Melanesia, Polynesia. It's a huge group of folks. And so whenever I'm working with someone in this group, if you will, I have to remember, what is the historical context? How is it possible that intergenerational trauma has lived through this person and you know, has affected this person? And then how can we together figure out how we can hold each other and how we can get their needs met in the space that they're in now, living on somebody else's land, with using traditional things as much as we can. Um, so there's no such thing as a 15-minute follow-up for my work.
Right, right.
There's just not. My model is totally different. You know, I mean, like, I'm like clumbering snacks. We're going to get into it. And
Right.
it takes a while to unpack some of this
Yeah.
stuff. And what you said at the beginning of this sort of like this thought process that we're on together is like how much separation, you know, how and again, we would really have to look at that. How much is this person separated from who they are as a human, who they are in their body? How much do they want to be connected? Not all Native Hawaiians are like, oh yeah, I want to get right back and I want to, you know, drink this tea and do this and do that. And that's because we've been here for so long, maybe, and we've been products of all that's come in the last 130 years, or really after Western contact. So it's important as a provider in this space and as a scholar in this space to really be mindful of all these different facets that come into play when working with this population.
Mhm. Um, I remember, I think I was in, I don't know what year of grad school, and I was in an internship that was so very proud and should have been for the time, especially to have an AAPI training
Mm.
um, for cultural competency. We had this big old binder, and each binder was like separated by, I don't know, really huge sections of like broad strokes of culture, like Japanese,
Hmm.
you know, Chinese, and so many different cultures were lumped into this binder. Um, and it, I mean, as you were talking through, you know, just how many different uh, cultures there are, and their each individual interactions with the United States. I just, this picture of this binder showed up in my head, like how, like, you know, you got to ask this culture that question, and it was just such like a blip in really the depth of history and culture and all of this, that was only just very, very slightly being represented
Hmm.
in this binder. And what a disservice that is to call that competency.
Hmm.
That there's so much history there that obviously we're not going to be able to learn from a binder, and
Right.
then one little section there. Um, uh,
Right.
but there is this weird. Uh, I know it happens in other places too, but a weird lumping together
Yes.
of culture, that is just so strange, really.
Yeah, and I think, you know, for a variety of geopolitical reasons, you know, several years ago, I think in
Mhm.
the 60s, 70s, the term AAPI and the sort of connection between Asian Americans and Pacific Islanders, you know, was birthed, if you will.
Mhm.
And I think that that served a very a very specific purpose
Mhm.
at that time.
Mhm.
However, today, fast forward, I
Mhm.
think actually that that term, what that term means and what that term does with
Mhm.
respect to data collection,
Yep.
has been a real hindrance to understanding the true incidence and prevalence of perinatal mood and anxiety disorders in the Native Hawaiian and Pacific Islander populations, and mental health in general, everything in general. You know,
Mhm.
COVID was a
Mhm.
great example. When you look at the data, you know, Pacific Islanders actually were much more hit than Asian Americans, but the data didn't show that. And so then where do the resources go? We sort of know how all of this works. Um, the other thing that is sort of the bummer about that is that when you look at resources and funding and appropriating funds for programs to help folks, what you end up getting, if you just take a peek at most of the things that are AAPI, is only Asian American stuff.
Hmm.
So not only is that true look at where are we here, it's not there, but
Hmm.
when we're sort of offered opportunities to get help, it's not congruent with our cultural background. And so it again just kind of pushes us out and so I think definitely again from that legislative front, we need to really start looking at ways to disaggregate data if we can, and to create new ways in which we can capture data, so that it's truly telling of the actual problem. In Hawaii now, there is a bill that just passed in, I think it was Senate Bill 99 or something like that. Forgive me, I can't keep up with all the states, but this passed last year, or the year before, and it was specifically to capture racial and ethnic data with respect to perinatal mental health, and to have true cultural competency training for everybody in the perinatal mental health realm. And I'm hopeful, as are other people in this space, that by something like that, we'll now be able to see what's really going on, especially
Hmm.
in Hawaii. But that doesn't offer much to the rest of us here. So just for numbers, there's about, I think the US Census data in 2019 came out with like there's about 1.4 million Native Hawaiians and Pacific Islanders living throughout the United States. About 355,000 or so of those are in Hawaii. So simple math shows you that there's like a million of us here. And although that's only like 0.4% of the population at large, that's still a million people, right?
Hmm.
And if we're having these bills that can finally look at data, but it's only affecting 355,000 people and the rest of the million are here, what is that for us? It still just gives us a lot of work to do, so that we even know when we are starting to get these cultural competency binders, or we're having training in culture, we have a better sense of like what we're looking at.
Hmm.
The last thing I want to say about that is I don't know. Can you ever be truly culturally competent? I mean, this has been, pushed around in scholarly circles in academia forever.
Right.
I'm of the opinion, no, you cannot. How can I, as a Kanaka Maoli who was born here, in Chumash territory, know what a Chamorro person has experienced if they're first gen here? I cannot. So that concept of humility, or
Hmm.
ha'aha'a, and cultural humility that we've heard about, and the work that's been done on that, I think is a more just way to go
Yes.
in our idea of like how we care for other humans experiencing similar things, or like mental health challenges.
Oh, right. Yeah, I think the idea of competency needs to just go.
Bye
Um,
bye. Yeah.
bye bye.
Yeah. Yeah.
Yeah, for sure. And yeah, in my training, that's I left with that feeling like I knew something, and I knew a little bit more than I had known before, but it just does a disservice to everybody. And me
Yeah.
too, even to call it
Yes.
competency. That
Yes.
somehow I
Yes.
walk out in the world thinking I can help somebody when that's not how this works. Um,
Right.
right. It helps to have education and understanding, but this like as you were saying, like the combining together of so many different cultures into to one, you know, document. It doesn't help anybody. It ends up being additionally othering. Um,
Yes. Yes, exactly. And I think if if you see like my website, I really really try to live and to work and to be in community through like these. I have like 5 different like Hawaiian concepts that are there. I try to incorporate many others into my world, but one of them is that term ha'a ha'a, and it's humility. And for Hawaiian people, and for myself personally, like really being humble about where you're coming from, like when the person is on the other end of your screen. And I say that because I only do telehealth, but really
Mhm.
being humble and really just, opening up the space and letting them know that they're safe. And then you can learn about what their culture is. Might
Mhm.
not be the same, but you can learn. So that goes to for all, all of us as providers, I think.
Yeah.
And me too, I don't just take care of, because there's only a million of us here, right? So clearly I'd have no practice if I just took care of, Native Hawaiians and Pacific Islanders. I take care of all sorts of folks, and I don't know. So, we just sit, and that would be my message to other providers too. It's just sit, and create safe space for someone, and it all comes out. And at the end of the day, we are all human. The word Kanaka means human. Maoli is like indigenous to a space, but Kanaka, we're all Kanaka, we're all human. And so really sitting with the person and trying your best to just help them put together the pieces again so that they feel okay, so that they can take care of their baby, they can take care of themselves, they can do all the things that they need to do.
There's so many layers of culture, and this can be like ethnic culture, but family culture and so
Mhm.
many other things, specifically for perinatal mental health, and I suppose for Native Hawaiians. Um, is there anything that you're seeing or that you can speak to, um, that is, I don't know, related? I can't, my question machine isn't working.
That's
Like,
okay.
like, what are some things that you're seeing related to perinatal mental health that might be best supported through a cultural lens?
Mm, that's a great question. Um, I think one of the things that we're noticing in our community is, especially since 2019, there was a huge stand for Mauna Kea. Mauna Kea is one of our most sacred mountains in Hawaii, on Hawaii Island. And that really brought together a large portion of Native Hawaiians, even, from the United States. We all kind of came home. Other Pacific Islanders flew in to support us. And after that, what I've noticed in our community is that we really are, there's a huge resurgence to reconnect with traditional practices surrounding birth
Mhm.
and surrounding parenting, and rearing our children, our keiki. And one of the things I think that folks are realizing is that when they enter Western spaces, like, say, the traditional OBGYN setting and having a hospital birth, many of the practices are incongruent with what, our traditional practices were. And so, but because of that sort of like, sort of uh, reconnecting to the idea that we have ea, or sovereignty, within ourselves and our people, um, I think many Native Hawaiian women who are birthing and going through these very Western systems are really now realizing that, wait, I don't have to do this. This doesn't feel
Mhm.
right.
Mhm.
And I don't want to do this.
Mhm.
And so, I think, if you're caring for somebody that is, Native Hawaiian or Pacific Islander uh, person, it's important to recognize that this is sort of a trend that's going on in our community right now, and to make sure that they're connected to all the sources that they could be connected to that are empowering for them. So I mentioned Mana Pasifika up in Northern California. There's also a great service that just got a grant, in Hawaii, who is training on all the outer islands, in training indigenous birth workers, and to help women in their community who are Native Hawaiians and Pacific Islanders birth with all of these different things. So they're essentially, doulas, if you will, but they're partnering with them to go into these Western systems to allow them, just like doulas do in many other, with many other folks, to allow them to be empowered and to get their needs met.
Mhm.
So, there's, I don't know if that answered your question. I think I went off a
Mhm.
little bit, but
No,
but
it's great.
but there's a huge sort of push for that right now within our community, and a reclamation, if you will, of our ea, of our sovereignty as mothers, as families, as birthers, as creators. And so, that's what I'm seeing. I'm seeing folks coming in saying, wow, okay, I can have this. I can have my traditional foods. I can have somebody advocate for me. Wow, this is cool. Okay, this
Mhm.
is neat. And those are the things that I see as a clinician. Those are the things that move people. Yes, I can give you a prescription for sertraline. I can do that. Is that going to move people? It's going to stabilize some neurons, maybe, but is that really going to heal? No, it's not. These things are going to heal,
Mhm.
connecting back to our indigenous practices and other people that can help us, and are knowledgeable about what those are and help us to become empowered. Those are the things that are going to heal and that do heal many of my clients.
Right, absolutely. It's not like a direct line in so many ways for so many reasons. Not a direct line from, oh, okay, you have depression. Here is a depression coping skill, and now you're better. It like all of these layers of culture that I think we were talking
Yes.
about before. All of that is mental health. It's all physical health. It's all spiritual health. Like
Yes.
it's all the same thing. You can't delineate one thing from the next. And I think that's a downside of Western medicine,
Mm,
Western lots
yes.
of stuff is that it is all you go to this doctor for that and that doctor for that. And there's some benefit to that. I don't want, you know, somebody helping with my heart who's a foot doctor necessarily, but
True. Yes, but I hear
um,
you. Yes.
but it feels like it's become so distinguished from each other, and delineated rather from each other, that the point is gone, that
Yes.
all of it matters for mental health.
Yes, you're right. And you'd mentioned the term intersection, that concept of intersectionality, I think, is something that we see a lot in papers and all of this. But really, it's great to talk about it because it's true. There's all these intersections, but the ways in which our systems work don't support that concept or looking at it in a really holistic way. Again, for instance, the follow-up visit for a psych MP typically is 15 minutes, and an intake is anywhere from 45 to 90 minutes. My intakes last 2 hours. My follow-ups are 50 minutes or so. It depends. I also do lactation. There's, because it's all connected, right? And
Hmm.
I don't know. And that was another thing that I wanted to be really clear about in my practice. If I was going to name my practice Mana, mental health, I was not going to practice in this Western model, only to the degree that I had to, right? I mean, I
Hmm.
have licenses, I have degrees, I have scope of practice, I have all these things, and I'm very, I totally respect that. But nobody says that I need to do this in 15 minutes. I
Right.
can still, I take insurance and I bill insurance for my codes, that most people bill for 15 minutes. It's an hour for me. It's okay.
Hmm.
I wanted to create it in a way that I felt like I was going to be whole too in this. And so, um, yeah, all of the things come into play. And I think when caring for Native Hawaiians and Pacific Islanders, especially in the diaspora, especially away from our homelands, wherever they may be in Oceania, um, we need to have time to hold this person and hold each other. And so I don't know, that's just what I hope to do. And again, I don't just take care of, like I was saying, Native Hawaiians or Pacific Islanders. I take care of all sorts of people. But no matter what, if you're going to come and you're going to see me and I'm going to see you and we're going to work together, I always joke with other clinicians that I'm always going to have people in the dirt. There's always going to be my patients. They're going to be like, oh, that's Kalena's patient right there because she's like touching a tree. Or her feet are going to be in the water. Or, there's stuff like that. Like I'm always going to, Uncle Israel Kamakawiwo'ole, he always says, like, we got to figure out how to integrate our Hawaiianness into things. And that's what I always try to do with no matter who I'm working with. We need to stop, take time, get back to source, and figure out all of this together because we're all in it together.
Hmm.
One thing that that I think might be helpful for other practitioners, again, because everybody is going to encounter somebody who's Hawaiian or Pacific Islander, maybe in their travels as clinicians, is I've in my 50 years almost of being here, I've only met one person, one, when I said I'm Native Hawaiian, that said to me, "Whew, your people have gone through a lot." All the other people in my time in this realm have said things like, "Oh, I love Hawaii. Oh, we vacationed there. Oh, I have a timeshare on Maui. Oh, we went there to Kauai to get married. Oh, we're going in June. Oh, we had a luau. Da 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 da. And so being Native Hawaiian specifically, I cannot speak to, being any other Pacific Islander, but Native Hawaiian specifically, almost my entire identity from somebody else is sort of like a vacation or a hula dancer with a cellophane skirt or on the dashboard bobbling back and forth. And that is extremely hurtful or can be hurtful, especially when you go to somebody for care, because automatically now you're a commodity in their mind, yeah, or your people or your place. And it's a very quick way to know that I'm probably not going to get the care here. There's no way they can hold space for me if they automatically think of me and my people as this object or this thing of pleasure. And so that somehow I think would be important to convey to other practitioners if you are caring for somebody, that maybe your first connection to that person be something more on a human level if you don't know. And if not, then something that conveys that you kind of understand that historical trauma that has taken place and that is still taking place, so that they know that they're in a safe space with you as a human, as a practitioner, a clinician, because that I see it from myself is not something that has ever come across. So just that would be it.
Extremely important. And I think that is, as I was saying before, there's so much more to understand. There's so much history, so much. We're just kind of barely touching on a couple of really important points here. But I do want what you were just talking about to be the thing that we leave with folks to think about. I think there's in kind of arcs of stories and podcasts, in some ways you like start off with what was difficult and then you end with what is like uplifting and hopeful, and there's space for that. And also I think this is an important point to leave people with, as to take forward with them, because it would be exactly to your point, it would be like, you know, following the line of like, oh, the things that people associate with maybe going on vacation is like going there to like have a good time and feel good and leave good, and you're leaving out a really important piece of the truth, which is what you just described. So I really hope that people can hear that and take that with them forward.
Yeah, mahalo again for creating this space and for asking the questions, and for just having this this venue, if you will, and your time and your energy and your mana put into this. It's a really beautiful thing that you do.
Thank you.
And I think all of us that are in this field are very fortunate to have this podcast, and to be able to listen to inquisitive questions and to hear other ways of doing things and people's experiences. So I'm honored to be a part of all of the others that have come before me, and just part of this whole thing. It's been really lovely.
Thank you so much for everything you're doing and for your time and for sharing a piece of you with us here.
Yes, of course, of course. He mea iki.
Please connect with Kalena at manamentalhealth.com or on Instagram at mana_mental_health. As usual, sharing these episodes with people that you care about or whoever you think could benefit from this podcast is always welcome, as we need to keep continuing this conversation on perinatal mental health and how it affects us and those that we care about. Thank you for listening. Until next time.